Hi, so welcome to Channeling Beauty with DaniB, and this is actually my day 14 post-op video for a blepharoplasty. The sort of evidence remaining is lack of mascara and the bruise here, but I did not record a pre-op video for I don't even know what reason. I didn't have my wits about me, I guess. So I do have videos in week 1, like day 1 through 7, and then I have 8 through 14, today being 14. So I'm recording this intro video to the blepharoplasty, even though it's day 14, because it needs an introduction for the first 7 weeks or 7 days. I wish it had been 7 weeks. So I had a blepharoplasty 2 weeks ago, obviously, and I had it actually less for cosmetic reasons than I had a really large lump in my upper eyelid that we thought was a tear duct falling, that had fallen from behind the bone, or excessive fat. And it just looked terrible. I have a pre-op photo. We'll paste it up here and you can see how it looked right before surgery. And you'll see this whole area here is just marked up and it looks like it's falling. So it turned out to be a marble-sized, so spoiler alert here, but marble-sized clump of filler from years before from my cheek. I'm really not kidding. So in the process of cleaning that up, obviously, if you're going to go undergo eye surgery, just clean some other stuff up. So in my next video, you'll see, or the second part to this same video, you'll see in kind of the first couple of days, I'll explain why I did what I did, what my surgical history is with blepharoplasty. And for those of you on the fence, I'm absolutely happy to answer any questions that would help you. I know I don't look super great right now, and you're probably thinking, if I'm going to look like her at the end of this, I don't want to undergo the procedure. But my eyes have, they took a bit of a beating. They've been looking good the last couple of days, are looking better, but I do still have some asymmetry. And obviously I have a bruise, and that's actually from a CO2 laser, not the bruise, but from the injection for it. And she said it at the time, sorry, you're going to have a really bad bruise. And I have. This is 2 weeks, and vitamin K and arnica aren't doing anything. So anyway, welcome to my 2-week blepharoplasty journey. This is going to be the first week, and then I will post the second week. And then after that, I will start to just post maybe once a week with an update on how things are going and how it's progressing and what you can expect if your procedure goes like mine. No 2 procedures are the same, and no 2 eyes are the same. So even though they were done at the same time, they will heal differently, and the outcomes may be different, which is unfortunate, right? If you like one and you don't like the other, then that can become a bit of a problem. But we'll talk about, I'll talk about that in my videos and just be super candid for anybody who is interested in the procedure, how it goes, what it feels like. You're welcome to ask me any questions in the comments and share any tips that you have for others, and I will be happy to answer them. So let's get started with this whole process. Hi, welcome back to Channeling Luxury Beauty with DaniB. Thank you for watching this video. So I wanted to post a week blepharoplasty update video. The video, obviously, at the introduction of this video series, or this video on bleph, is several days after this point. And I did that on purpose because I don't want anyone to freak out when if they saw me like this. This doesn't look like Channeling Beauty, right? This looks like channeling Frankenstein or something. So I thought I would walk through a little bit of kind of the process, some of the things I've learned so far. This is not my first rodeo with this surgery, but there was a different reason that I had it. And I'll show you in the graphics, I'll show you on screen the reason. It wasn't for the same reason as last time. And walk you through a little bit of the healing. You can see I have this lovely bruise here, and talk about some of the questions you may have. And I'm happy to answer anything. As full transparency, full candidness. I think the stigma around all of these things should be gone if it's not already, and personal advocate for that. This is not just always beauty is pain. This is about how you feel about yourself. And if getting a little surgery on your eyelids makes you feel good, then I personally am all for it. And I know people who think different, and I respect your opinion, but this channel is probably not for those folks who have that frame of mind, or maybe just want a different perspective. So that said, if you find this unique, interesting, I will be posting what I do throughout my life, And please subscribe and hit the little notification button so you can be notified when there's new content. Obviously, this channel will have less new content than my channeling luxury designers and channeling luxury travel, because I don't plan on doing surgeries and treatments nonstop. Actually, well, so I am in my, I guess technically now late 40s. And the first time I had a blepharoplasty, I was in my mid 30s. I went to just a local plastic surgeon that I trusted, interviewed a couple of them. And I had done it then because I had significant eyelid hooding. So my eyelids were essentially falling. It was from sun damage. I spent too much time in the tanning beds when I was younger. I've been paying a price for that, by the way, between skin cancer, multiple skin cancers, and having to use IPL, which I'll do another video on because I still have some discoloration from IPL. That's not the fault of the provider, by the way. I have very, very high pain tolerance. Kept telling her to go higher. So I'll talk about what happens when that happens in a different video. But for now, in terms of this particular subject, I had done that because of genetic hooding. My grandma, my mom all had that. I thought it was aging my face tremendously. And also I had significant sun damage that had caused premature aging of the eyelids. So when I was in my mid 30s, I sought out a plastic surgeon in my area in Orange County, California. She did a great job. At the end of, it was a longer recovery than this by far. This is 7 days post-op, by the way. 7 days post-op, I still looked like I had the crap beat out of me by multiple people. The running joke if I left the house was you should see the other guy, because it looked really bad. So for me to look like this is something I'll explain. It's not real. Well, it's related to this, but not really. If you just saw this, you probably really, unless you saw the end of you can probably see them right here, the end of the sutures, you probably were looking up close. You probably wouldn't really know I had done much other than I'm not wearing any makeup, right? And clearly no Botox or anything else, which you shouldn't do for at least 6 months before you do blepharoplasty. That's, some surgeons will tell you differently, but my research has shown that is pretty common. The reason is you don't want your face frozen, and then they do the surgery with your face frozen, and then come to find out that, you know, your lids are really down here and you really didn't do much when you had your blep, right? So don't waste your money and your time. Just do without the fillers and the Botox for 6 months, 9 months for fillers if you can. Listen to your own surgeon. I'm a research professor, right? In tech, business management, and quant methods. So listen to your own surgeon. Obviously, I'm not giving you medical advice. I'm just telling you what I've been told by surgeons, what I've read in the literature, and best practice from practitioners and other people I know who have had the same procedure. So most of my friends want this procedure, whether they've done it or not. Some of them will admit it, some of them will not. But I think we can destigmatize this entire thing and also bring more accountability to the industry, because we all know celebrities who post videos of my plastic surgery gone wrong. Sometimes it's excessive, it's too much, it wasn't the right procedure, they overdid it, and multiple surgeries stacked that caused the problem. Or sometimes they had bad luck, and I have certainly run into my share of bad luck. I had quo. I'm going to be posting about my bad luck. Now, I haven't been able to do treatment 2 and 3, and I'm undergoing laser therapy, and I may never get rid of the damage from quo, but that's another video for another day that I will, after I've posted it, I will link to it around this mark. So as far as blepharoplasty, so this time what happened, and I will put a little image up in the corner so you can see. So when I first sought out an oculoplastic surgeon, so I wanted someone who just does only the eyes. Sometimes they'll do the upper forehead if you want. I did not do that. She recommended it, but I didn't want it. You usually often lose feeling in the upper head. And I think if you're going to do something in the face, you should do it in its entirety, like a facelift at the same time, because the proportions get kind of screwed up. And surgeons don't like to work after other multiple surgeries. So the eyelids are not really that big of a deal, to be honest. From my perspective, in terms, I'm not saying things don't happen, shit doesn't happen, just that in terms of the overall scheme of plastic surgery, it's relatively painless. I actually had no pain whatsoever. The downtime's not really that big of a deal. The risks are most commonly, and still very rare, inability to fully close your eyelid. That often self-resolves as it stretches. So you just want to make sure you have somebody really good, measures 5 times, cuts once, right? And really knows oculoplastic, which is why I wanted someone who only works on the eyes. And of course, there's always the 1 in X percentage that, or the X percentage that can have severe complications like blindness and so on. Again, that's why I sought out an plastic surgeon that just does eyes. So she's also, I believe she's also an ophthalmologist, and I will put her information in the comments for those of you interested in working with her. I did interview quite a few people. Sometimes you don't really know. You feel like you've met 4 or 5 great surgeons. You're not really sure who to work with, and you feel a little bit confused. I felt zero confusion, zero. When I met her, I knew she was the person I wanted to work with. She uses laser for the opening if you choose it, which reduces in less bruising, less downtime, less scarring. Although if you are at risk for hypertrophic scarring, particularly people with darker skin, it actually increases the chance that can happen. So again, that's from literature, but talk with your plastic surgeon about that risk if you have darker skin and you're choosing a laser to open. It is an increased risk. It's small, but it is an increased risk. So sorry, you'll hear a lot of the research side of this because that's what I do for a living. So anyhow, I sought her out because I had a bulge in my right upper eyelid, and it was getting larger, and it had been 2 years. And even my 11-year-old, when I would close my eye, was like, "What's wrong with your eye? You can really see it." So did I have some hooding? Yeah, but I'm in my late 40s, right? So I was very happy with the level or how my eyes looked for my age. But if they're already going to open it up, why not clean up the rest of the stuff? So I did want to see what was going on here. So there were 2 working theories. One of them is that it was a deposit of fat, which can happen. Usually that would happen to both sides, so that was a little weird. The second thing is that my tear duct, which is around here, one of the glands had actually fallen. And that's uncommon, it's rare, but it happens. And what they can do is actually reattach it back where it should be. And you do lose some of the tear duct's capability, but there's enough left that usually shouldn't be a problem. Again, check all medical facts. Please check with your own surgeon. Don't take my word for medical facts, please. That's just my disclaimer. It's not because I don't trust myself. It's just my own disclaimer. Now, that said, I wanted to have that treated. It's almost impossible to remove something. It was pretty large. You'll see in the graphics. It's almost impossible to remove something like that without altering the structure of the eyelid. And then you want them both to match, right? So you end up getting blepharoplasty in the process. So sometimes if you've been doing Botox under the eye, this happened to me, by the way. Again, the 1 in 10,000, 1 in 100,000 seems to happen to me. I can't even tell you how many stories. You'll see them over time. I had a dermatologist hit right here. It was levator muscle. For my 40th birthday, I couldn't smile for 3 months. This side of my face couldn't move, right? So I like to avoid Botox under the eye. A lot of practitioners won't do it at all because of that side effect, not because it doesn't work. I have had a couple of dermatologists be willing to put a couple units under here just to stop the crinkling, because if you're able to stop the crow's feet before they start, you can actually help reduce deeper wrinkling later, which is much harder to remove than fine lines. Botox will get rid of fine lines for the time that it's active. For me, that lasts about 2 months. I'm not a heavy Botox person. A lot of practitioners will say, I'll use 45 units, 50 units in your forehead and your eyes. No. 20 units here and here. That's it. I don't like to feel like I can't move. I just want to have a little bit of a chance to get ahead of deep wrinkles, right? So you can see in my late 40s, this is where my forehead is at with nothing at all. I mean, almost my daughter at 11 has that much, right? And I really do attribute that, because it certainly isn't from staying out of the sun. I do attribute that to proactive Botox. So that all said, I needed to get this thing that is no longer there removed. My surgeon promises a few things: complete and total pain-free procedure. Keep in mind, I've had this before. Last time I had it, I refused any relaxing medication. I have to go back to work immediately. I don't get downtime. If I don't work, I don't get paid. So I go back to work right away. I can't close my eyes and put ice packs on. I will admit, I iced one time. You'll still see my eyes look heavy right now, right? After a week, they still look swollen. That's normal. Mine are probably a little more swollen than yours might be. if you do this, because I did not ice. First of all, I hate ice. Second of all, I don't have time to lay on my back with ice on my face. I have to get right back to work. So at night, maybe I iced once, maybe twice, actually. I'll take that back. So it was one more night I put ice on. That's it. You know, did I tell my surgeon? Yeah, I'm not an icer. You can recommend it, but I'm not going to do it. I know what it does. I know it reduces swelling. It also reduces the blood flow to the area, which is good. It restricts it a little bit so they can heal, bruises can heal faster. But for me, I need to get back to work. So that's my own personal trade-off. I've literally never had a surgery where I didn't immediately go back to work or work up until the moment of surgery and then go right back to work after. So it usually means I refuse pain meds. It also means, including when I'm in a ton of pain. And also I refuse anything that makes me sleepy because I need to get back to the office. I need my emails to make sense. So I do work from home. So all of that, which is where I'm filming this. I'm not in my set right now. I'm still, not feeling 100%. So I just thought I would do this kind of impromptu video. So this all said, the reason the first time I get was for hooding. I refused the drugs to make you sleepy, which are usually Ativan, Xanax, or Valium. It's one of the three. Sometimes it's all of them or a combination. So I just had her inject the local, and I watched as much as she allowed. I have this weird human trick. I can close one eye and fully see out of the other one. I don't know why. I actually practiced this when I was a teen, right? When everyone was partying, I was practicing stupid human tricks. So, truth. So, it's paying off, right? I get to watch surgeries. And I did watch as much as I could the first time. I really enjoy medicine. And so that's what I did. I had a lot of bruising, horrible pain when they removed the sutures about 10 days post-op. So that one was about 3 weeks before I really wanted to be doing anything. The one thing I've done this time that I didn't last time they told me to stay out of the gym, and I basically said, yeah, whatever. Went right back to the gym a couple of days later. This time I've stayed out because I don't plan on doing this again. And because the suture, this is a little different suturing technique. Most of the sutures are actually underneath the top layer of the skin, which I'm really happy about. Last time that was not the case. So last time the surgeon did them, I think, more in the fold. So they were more hidden. This time they're a little bit above, but it's hard to tell right now because I'm so swollen still. I don't really know where they're going to end up. Yesterday I was freaking out. I had a lot of skin bunching here. And last night I laid on this side and the skin bunching was gone by the morning, right? So swelling really distorts your outcome. So if what you're seeing isn't what you like and you still have swelling, don't freak out. That's my advice just in general, having done things in the past and learned the hard way that swelling is often uneven. The side you sleep on, the side you favor, there's a lot of reasons that it can happen like that. If you see swelling, don't freak out. Or if you see unevenness, it's too early, right? For Bleph, for me, 4 to 6 weeks, if I still have unevenness, I'll be asking about it. At 3 months, they can usually make some small corrections. So I did have different spaces in lid space and also in the gap of the eyelid. My eyebrows have fallen, by the way. That's just normal aging process. That's why she mentioned an upper brow lift. I just didn't want to go through all that. Then the downtime, the recovery. And again, like I said, I prefer to do facial things holistically if I'm going to do them. Just to keep the proportions and stuff right too. So this time, I didn't have the every few day photos. I saw her the next day because one difference is I did a CO2 fraxel laser under my eyes to try to avoid having to do Botox because I don't like seeing the wrinkles set in. I don't like, I think you can head that stuff off at the pass for the most part. So, one of the things that you usually would do with CO2, and one of the reasons people hate it, is you're soaking under your eyes or wherever you have CO2 fraxel, which is, I think it's the strongest, although fact check me on that. I think it's the strongest fraxel laser you can use. One of the reasons that people, they have to keep it really moist and they don't like it. Your eyes are full of gunk, your face is full of gunk. So this is 7 days after. There's still some swelling, but when the swelling goes down, I don't think I'm really going to have any fine lines under my eyes anymore. Now, fraxel doesn't last forever. So for me, it's maintenance. I have never done it before, but I can imagine doing it every 1 or 2 years. I know people that hate it. They think it's the worst laser, not so much for the pain during, but that after it just sucks. I didn't have a bad experience because I didn't do anything after. She didn't want Aquaphor to get in my incision line. So she just gave me an erythromycin. It's an antibiotic ointment to put underneath here, a very light amount every couple of hours for the first 3 days, and then every 4 hours for the next couple of days, and then discontinuing. Again, your surgeon may have a different protocol. Don't follow mine, follow yours. So that was what I had done. So it was lid blepharoplasty to remove it with the primary goal of removing whatever the heck that thing was, and then CO2 fraxel underneath my eye. So when I went in that day, I was pretty much hell-bent on not taking any sedatives again because I wanted to get back to work. But they were able to give me a later in the day appointment where most of my work was finished. And I took 1 Valium, 1 Xanax, 1 milligram, 10 milligrams of Valium, 1 milligram Xanax, 1 milligram Ativan. I didn't really feel anything. So I was chilling after she did her measurements, I was chilling in the OR waiting. And they said, how do you feel? And I said, well, I mean, I'm not nervous, so just go for it. And they were like, you don't feel anything? I said, no. So I took the Ativan and the Xanax again. And did I feel a little more sleepy? Yeah, I really didn't feel the effects of the medication until I got home until around 4 hours later after I had gotten home. I was watching TV and I think I dozed off for 10 minutes, but that was about it. I was able to function and work. My eyes were blurry. I know that is a cause for concern sometimes. It's the swelling, usually putting pressure on the eyes. And also, you've got a lot of crap in there, right? So they're putting drops, and you've got protective contact lenses and the numbing drops on the eye beforehand. They do sting. And so all that stuff kind of contributes to blurriness after, but I was able to see my phone and I could drive, and it was really not that big of a deal. So I came home, I did lay flat. I did keep my eyes above my heart. That does help reduce swelling. Iced, like I said, I think once, and then maybe later that night or maybe the following night. I can't remember which night. And other than that, it was business as usual. So that next day I went out to lunch. I wore sunglasses. I was you'll see in the picture here. So when I went to lunch, I did wear sunglasses, and my boyfriend said you could see the suture. So I was looking out the window, right, so that there weren't people looking at me, but that the waiter could see through my sunglasses and had kind of done a quick look. So my joke to him, so I just said, forget it. I'm just going to take them off. Why even bother, right, if you can see it anyway, and it's just one guy and him. So I just took them off, and then the joke was, he's like, you're going to get me in trouble. People are going to think I'm abusive. He's not abusive, I promise. And so, yeah, so that was kind of a funny part in all of this, but not abuse, just that we kind of just laughed about it a little bit, what people would be saying or thinking. People did actually look at him like, okay. So anyhow, so nevertheless, I was pretty red under here, pretty swollen under here from the fraxel of CO2, and a lot more bruising, but very little compared to the first time. And I think the laser opening helped. And my surgeon did say it's slower for her. She prefers the scalpel if she's working off of speed, if she's concerned about time more than anything. So it is a longer procedure, but probably by a couple of minutes, right, at the end of the day. So you do smell burning tissue. If you want to know what it's like to use a laser, you do smell burning tissue. But you're going to smell that with the laser anyway if you do it underneath your eyes. And to be honest, it's really not that big of a deal. So I took the second sedatives, felt pretty much the same. She came in, measured a few more things, and then we did some locals. As you probably know, if you're injecting something here and you tap, it still hurts there, but you tap over here, right, kind of distracts the mind a little bit. So her OR assistant was pretty good about hitting the other side. I really didn't feel the injections much. I think maybe one pinch at all. So topical numbing cream and the injections. And I remember the first time that being pretty bad. The first time I did it, this time, no. I think it was her technique. She's an outstanding surgeon, in my opinion. We'll see the final results, but that's how I feel as of now. That's why I selected her as well. So anyhow, the rest of the procedure was pretty quick. She did what she needed to do and then said, in the middle of the procedure when she got to this part, right? And, I'm still awake, so I'm like, what's what does that mean? And she said, it's not a tear duct and it's not fat, but I'm going to fully remove it. So we're all kind of a little bit like, wait, what? So I have anxiety a bit, particularly regarding health stuff. So my anxiety went up. I kept thinking of all the bad things it could be. Later researched glandular cancer, everything related to lymphoma and that gland, and so on, because that's my natural research. I'm a researcher, so that's what I do. I look stuff up. And if I'm anxious, I'm going to look stuff up even more. So I was doing that. And then, it just sent me into worse anxiety. So I stopped doing it and just waited for the biopsy, or not biopsy, the pathology, because the whole thing was completely removed. And it is very flat here now. It's gone. So this was on a Thursday. On Monday, I got a call from her. So I saw her on Friday, and she didn't want to see me for the incisions, by the way, because as long as you don't have an infection, and I just had a topical antibiotic to put over the incision line, it's really nothing to do. Just let it heal. And she takes the sutures out like day 8 to 10. So between tomorrow and Monday, I should have them out. And then I'll do another quick video then. She wanted to check under the eyes for CO2. I still don't know what she was checking. I didn't ask. I was too obsessed about what the heck this thing was. So she said, most likely it's something to worry about, but we sent it off to pathology anyway. Well, I've had enough skin cancers to just not really like the process very much, the waiting game. But by Monday afternoon, she had called me and said that it's a foreign body, but they don't know what. So she asked, have you had any fillers here in my temple? No, not in my temple. A couple of years ago, I had filler here. A few years ago, I had filler here. You can see now I don't have any, or I wouldn't have these deep lines right now. And so she said, filler is the most likely cause, but other than that, we don't really know until we continue to examine the tissue and try to figure out what it was. So I did a lot of research, but not to worry about it. It's not malignant, right? So it was not cancer, and they would figure it out. Sometimes they just don't figure out foreign bodies. So that said, she asked if I'd had filler anywhere else. So yeah, I had filler in my cheek, but it had been years prior. So I started researching filler migration. So understand that if placed properly with the right filler migration, especially to the orbital areas, it's so rare. It's considered a very, very, very rare side effect. That's how you'll see it listed. But it looks like when I go back to photos, I had a decent amount of filler here, and this side deflated faster, just looking at stupid selfies. Most of them with my daughter, right? So half my face is covered up anyway. But looking at selfies, it did look like the filler I had done a couple years ago, it did deflate faster here. And my best guess is it migrated from here to here. And it clumped together. So is that exceptionally rare? Yes. I brought it up with my injector, who is helping me get rid of the quo staining that I'll talk about in another video. And she was like, what? Because she has never had a client where that's the case. And she works in a med spa, but I trust her completely. She's extremely knowledgeable. So usually what I've read is it's a placement problem. So she might have to go deeper or use a different material or something. So we're going to go back through my chart, my history, and see what was done and when, and do something different if I ever do it again. But it was pretty interesting to see that. And I did actually have some nerve, something pressing on the nerve the last time I had it, pretty intense up here. So it's possible my body was not liking the location and that it did migrate up here. So it turns out it's some kind of foreign body. When I know what it is, I will report back to all of you. But it could be weeks. Right now, I don't know what it was. But my best guess is filler from the cheek. I never had it here, which are the obvious migration sources. Usually go to the kind of closest location. And this is really the only spot that I have consistently done in the past. And that is a really long way away. So it probably is from here. So that's that. The CO2 without having Aquaphor has been a piece of cake. If it works as well as it looks like it's going to do, I want to do my whole face and my neck and my chest, because, age does set in. It drives me nuts. I'm not some people say they want to age gracefully. I want to age as slowly as possible, full transparency. And I don't think there's anything wrong with that. My step grandmother, rest her soul, she was an amazing, gorgeous woman and well into her old golden years. And back then they didn't have as many things to help, but she still did things to help, right? So I personally don't see anything wrong with it. If you can afford it and it's not taking out of your family's food fund, and you're saving your money for it, then, go do what you want. So just weigh the benefits and risks. And you'll actually be surprised by this fact. Going to a specialist cost me less than the first time. When I went to a general plastic surgeon. And clearly, so this person that I went to has done more than thousands, I think she said more than 4,000 eye procedures. It's the Bleph procedure is very common. It's kind of one of those things people they can do in the office with minimal downtime for them and charge a lot for. And anywhere between $4,000 and $8,000 is what I've seen charged. And last time I was on the high end, this time not even close. So, but everybody's anatomy is different, right? What they need to do is different. What you select is different, and so on. So all in all, that's been the process so far. I'm excited to get the sutures out tomorrow. My eyes do still feel very heavy. They are still swollen, especially my eyelids. By the end of the evening, they get pretty puffy. And so I'm excited to see tomorrow how much better I feel. Sometimes it's just the sutures that are kind of feeling like crap. I remember from last time, it didn't feel very good to get them out. However, this time I know that she uses a lot of numbing medication, local or topical numbing medication. You might be wondering too about the pain of the CO2. I didn't feel any. So first she used topical, but she removed it. So there was really no more topical left. She injected under my eye with lidocaine, and that is why you see this bruise. So actually it was much worse. She said, crap, you're gonna have a bruise now. As though I wouldn't have had a bruise from the whole procedure, right? But it's how good she is. She really didn't bruise me that much. I had a lot of redness and I had bloody tears, which is totally normal, by the way, but it was pretty funny. My boyfriend and I were eating lunch and after my procedure in my home, and I had a bloody tear and he had ketchup and he's like, he had a hard time eating after that because he's a little more squeamish than me. I would just, be like, oh, good ketchup. I don't know. But anyway, that was kind of amusing also. But don't be surprised if you get bloody tears. It's normal. If you hold a gauze on them for 5 seconds, they should stop. If they don't, then you want to talk to your surgeon. So personally, I don't really like to work with surgeons that don't give out their cell phone number. I've had a surgeon that did something else in the past that made house calls. It's very rare these days, obviously, but somebody that really gives support, because these are not things we do every day, right? It's not like we got an ingrown toenail removed or something. So it's something that you want to feel like if you're freaking out, it's how you look. And when it's your eyes, it's a big, big deal. Anything on the face. So we really want to have the kind of support that you need. So I would encourage you to ask those kind of questions as well. How will I reach you if I'm just worried that night, right? So in theory, they'll give you a list of things to be expected and you'll worry less, but it's still nerve-wracking.